The crushing weight of unseen illnesses. A nation's struggle with mental health and the disability benefit crisis. The UK is grappling with a silent epidemic, one that's manifesting not just in overflowing hospital wards, but also in the stark statistics of a burgeoning disability benefit system. A groundbreaking report, jointly funded by the Joseph Rowntree Foundation and the Health Foundation, reveals a chilling truth. The dramatic rise in disability benefit claims is inextricably linked to a surge in mental health issues. The Institute for Fiscal Studies, IFS, has meticulously detailed the connection, highlighting that a staggering half of the increase in working-age individuals claiming benefits last year is directly attributable to worsening mental health conditions. This isn't merely an abstract statistic. It's a reflection of a nation grappling with the lingering trauma of a global pandemic and the systemic failures of a healthcare system struggling to cope with the escalating demand. The report paints a stark picture of a system buckling under the weight of unseen suffering. More than half of the overall increase in disability benefits stems from a surge in mental health-related claims, a testament to the devastating impact of untreated mental illness on individuals and the economy as a whole. The financial implications are staggering. The bill for disability benefits has skyrocketed, climbing by a nearly £13 billion to a monumental £48 billion between 2019-20 and 2023-24. This astronomical figure has prompted the government to announce planned and controversial, sharp cuts to the Personal Independence Payment, PIP, the primary disability benefit. The government's justification rests on the argument that the current expenditure is unsustainable. However, critics argue that these cuts will exacerbate an already precarious situation, leaving vulnerable individuals further marginalized and without the crucial support they desperately need. Beyond the immediate financial implications, the report unveils a deeper, more tragic consequence of this crisis: a surge in preventable deaths. After carefully accounting for demographic shifts, the researchers determined that there were approximately 3,700 more deaths in 2023 attributed to alcohol, drugs, and suicide amongst working-age adults, compared to pre-pandemic levels. This stark figure underscores the devastating human cost of inadequate mental health care and the urgent need for systemic change. These are not just numbers. They represent lives lost, families shattered, and communities fractured. The report's findings are not merely a condemnation of government policy. They are a clarion call for immediate and sustained action. Brian Dow, the Deputy Chief Executive of Rethink Mental Illness, succinctly captures the urgency of the situation. The pandemic shone a harsh light on our nation's mental health crisis, and this research underscores why it must remain a top national priority. He poignantly highlights the desperate reality of overwhelmed mental health services, characterized by agonizing wait times that lead to devastating consequences, suicide attempts, overflowing A and E departments, and the tragic loss of livelihoods. This isn't simply a matter of providing financial aid. It's about investing in comprehensive, accessible, and timely mental health care. The current system is failing those who need it most, leaving individuals adrift in a sea of despair with limited lifelines. The proposed cuts to PIP, while presented as a fiscally responsible measure, risk compounding the problem, pushing already vulnerable individuals further into the abyss. A truly sustainable solution demands a multifaceted approach: increased investment in mental health services, proactive preventative measures, and a fundamental shift in societal attitudes towards mental illness. We need to move beyond viewing mental health as a personal failing and recognize it as a critical public health issue demanding comprehensive, compassionate, and sustained intervention. The human cost of inaction is simply too high. The time for decisive action is now. The future well-being of the nation depends on it. Ignoring this crisis is not an option, it's a moral imperative.